While the nation continues its conversation on race, the next generation of doctors is working to fix racial biases in medical school. Our medical fellow Akshay Syal has more.
Naomi McKenzie has dealt with racism her whole life, but she still was surprised when she found it so rampant in medical school.
I saw repeated over and over again that race was a risk factor for disease.
The CDC states that African American adults are twice more likely to die from heart disease and 50% more likely to have high blood pressure than white Americans. These racial discrepancies could be factored in a doctor's decision-making when treating patients. But is race, as just one potential risk factor, being over-accounted for, while other attributes are ignored, like socioeconomics or limited access to healthcare? One example stood out to Naomi.
I decided to look at the kidneys just because it was one very concrete example where this was where race is used in an algorithm.
Naomi questioned why race was being factored into a GFR test, an important marker for kidney function that impacts a decision to offer life-saving kidney transplants to patients.
There's a set equation that says if Black, use this variable, if non-Black, use this variable.
After 2 years of Naomi and her team looking at the data and countless hours talking to faculty, the University of Washington announced they will no longer factor in race when evaluating kidney function. There isn't enough evidence for how this change in policy will impact the health of their patients. In a statement, the University of Washington said, "This is a momentous change where UW Medicine is leading the way." This sentiment is echoed even past the days of a classroom. Dr. Tomas Diaz, an emergency medicine doctor at UCSF, wants to rethink how doctors see race in patient interactions.
I don't want to sort of completely take race out of the equation. I just want to reframe that in terms of how we think about race. It's an exposure to racism.
How does having a better understanding of race ultimately make you a better doctor?
I think a better understanding of race also instills a sense of empathy that benefits all patients because being able to imagine, though not fully understand, a patient's experience is an important part of caring for them regardless of their race or class or gender or social circumstance.
Now, Elizabeth Stein, one of Naomi's colleagues, is helping future doctors understand race in medicine by starting an anti-racism summer reading program. And with nationwide protests over the death of George Floyd, more than 150 medical schools have shown interest. The book students are asked to read is Fatal Invention, which looks into how race was actually constructed.
If you educate incoming students about that history, they're going to be so much more critical and ready to ask questions and dismantle vestiges of racism throughout their medical education.
This reading program is a start for a conversation that will continue throughout our medical careers.
I think that there's more and more push from students and from faculty to push administrations to really advocate for more anti-racist medical training.
Alabama seeing a surge in coronavirus cases, particularly in minority communities. NBC News correspondent Ellison Barber joining us now from Selma, Alabama. Ellison, you've reported that historically Black counties are seeing nearly 3 times the average COVID-19 cases per 100,000 residents. What resources are these communities lacking? What do they need? And is the government on either the state or the local level making changes to try to fix that?
Hey, Allison. Yeah, so I mean, we've been in what's known as the Black Belt area of Alabama for the last 2 days. You have about 19 counties that typically fall into that category. Dallas County, where Selma is, that's one of them. We've also been to Lowndes County nearby, where they have one of the highest per capita rates of COVID-19 when you look at their population. It's a small rural area. They have about 10,000 people living in that county, and about 4% of their population as of this morning have confirmed tested positive for COVID-19. People here, they say that a lot of the issues in this area, high unemployment rates, poverty, lack of access to basic things like food, healthcare, as well as just proper sewage. They say all of those problems existed before COVID-19, and COVID-19 has exacerbated it. They say many of those issues date back to Reconstruction, and they say a lot of them were systemic built racist issues, things like roadways being built around Black communities, so opportunities, they didn't come into those communities either. So now that COVID-19 has come and really spread in this area, you've seen even more issues come up. This right here is the Black Belt Community Foundation. They're a nonprofit that works throughout all of these areas, and they've been pretty critical in helping make sure that people in these communities impacted by COVID-19 have more access to resources. One of the big problems is access to testing, also just getting health care. People have to drive incredibly far often to get to their nearest hospital. They say that the state, the county, they've tried to expand, add some temporary pop-up testing sites. Residents we've spoken to say it's not enough. But one thing that's been very helpful, we're told, is this foundation. They've been doing things like, you can see in here all of these different boxes. They're actually opening some of them now. They've been doing things like collecting donations, money to then put back into 12 of the counties in the Black Belt community, in the Black Belt area, that are really dealing with the largest rates of unemployment and also poverty. So they have 100,000 cloth face masks inside that were all donated. They arrived yesterday. They will then distribute to people in the areas. That seems like a simple thing, but they tell us that a lot of the people in the Black Belt communities, not only do they not have access to that because they simply don't live near a lot of stores, they don't live near big grocery stores, they don't live near Walmarts or Targets, but also even if they had access to buy cloth face masks, like a lot of people have done ordering online, they simply don't have the money to do it. So there are a lot of resources that are just not available to people here simply because so much of the Black Belt, which originally got its name because of its rich topsoil, is really isolated, incredibly rural. And we're seeing a lot of the problems that they've had in the past really get a lot worse and kind of risen to the front, if you will. And some people we've spoken to, they say that this is really, in a weird way, a blessing of COVID-19, because maybe for the first time, some people who hadn't been paying attention are starting to see how hard things are for a lot of people in the Black Belt, especially when it comes to just their general living conditions and well-being. Allison?
Allison, you mentioned you've been speaking to people there in Alabama. I know you spoke with a pastor who's been trying to help his community through this crisis. What did he tell you?
Yeah, that was a Pastor Braxton over in Lowndes County. He's born and raised in that area. He said that it feels like right now he's having to bury someone almost every single week because of COVID-19. If I can, I'll let you just listen to what he told us.
In the last 10 days, I've buried two members of this church with coronavirus, and I buried a neighbor with coronavirus. Three of them who were really a part of the Snow Hill Christian Church family. That hit us pretty heavy.
The people we've spoken to say some of what makes all of this so hard is that they are small, close-knit communities, and they feel like this disease is just a pest that is ravaging through so many of these small areas where they already didn't have great access to jobs, didn't have great access to health care, and now when they need it most, they really have very few options. Allison?
Yeah, Ellison to bury three folks in just a few days. It's overwhelming. Ellison Barber in Selma, thank you so much. A common steroid on the market for decades could be the first life-saving coronavirus drug. British scientists say dexamethasone, used to treat everything from altitude sickness to eye inflammation, has been shown to reduce deaths by 1/3 in the sickest COVID-19 patients. NBC News digital reporter Erica Edwards joining me now. And Erica, researchers at the University of Oxford in the UK did this study. Could you walk us through their findings?
Yeah. Hi, Allison. This was a big study. Those researchers compared the effects of dexamethasone on about 2,000 patients with COVID-19, compared them with about 4,000 patients who did not get the steroid. And their findings were actually pretty significant. They found that using the steroid on patients who were the sickest, those who had to be intubated on ventilators, their deaths were reduced by about a third. And among patients who had trouble breathing, but they need a little bit of extra oxygen, their deaths were reduced by about 20%. So there was no benefit, unfortunately, on patients who were not given oxygen. But again, this was really significant. I mean, this group showed the most benefit, had the most dire outcomes generally. Drug's been around for 50 years, as you said before, and it's been used for many years. Patients who have had, to treat nausea after chemotherapy, to treat nausea after anesthesia, even used in kids with croup. So it's pretty significant findings. Allison?
Any side effects, adverse reactions, things we should be aware of with this drug?
Yeah, so doctors know this drug really well. There are some minor side effects. Usually it's tolerated pretty well. Some of those side effects can include weight gain, and doctors don't want to keep patients on it any longer than necessary. There is some indication that the drug should not be used on patients with compromised immune systems. In fact, it could, in some rare cases, it could actually lead to infections. But overall, the drug is pretty well tolerated, and doctors really do understand it well after all those years of using it.
Erica, yesterday the FDA revoked the emergency use of hydroxychloroquine for the coronavirus. What do you say to people who are excited to get their hands on dexamethasone at this stage? I know anytime we hear positive potential news about potential treatments, a lot of people are thinking, okay, great, this is something I may need.
Right, exactly. And you're right. It is very exciting. However, it also needs to be said that the researchers at the University of Oxford really didn't give us the full data. There's really aren't too many extra details about what they found, which patients that was used on. And so I also want to say that it can't be overstated. This drug should not be used to prevent the coronavirus. There is absolutely no indication that it could work in that way. Only physicians really have a good understanding of sort of this narrow window of when it should be administered for some of those patients. You give it too early, and it could, in fact, interfere with the body's natural immune system, trying to tamper down the virus. So it's a little too early to change practice, but doctors are cautiously optimistic about the findings.